Covert compulsions. All the examples pointed out above are of obvious compulsive behavior, that is, conduct including physical actions, but some compulsions are concealed or mental. Sadly, a lot of writers on obsessive compulsive disorder and lots of medical professionals, psychologists, and psychiatrists tend to assume that compulsions are always overt behavior. They consider fixations to be mental events and compulsions to be overt motor events. That division is inaccurate. It's certainly true that fixations are psychological events, but not all compulsions are motor behavior. Many clients have concealed or psychological compulsions, which have all of the highlights of obvious compulsions and such. Here are some examples. 1. A man had the compulsive urge to say calmly a particular string of words whenever he heard or read of any catastrophe or mishap. 2. A middle-aged woman who was distressed by the intensive recurring appearance in her consciousness of obscene words carried out a compulsive routine each time this happened. This included changing these words into comparable, acceptable ones. For example, well for hell, and saying them quietly 4 times. 3. A middle-aged man had the urge to imagine everything that was said in discussion to him and what he was going to say in reply. He would not reply until he had acquired these visual images. 4. Lady who was tormented by intrusive repetitions of bloody pictures of her relations and friends felt forced to reform those images with the people concerned in good health. 5. A young woman became really worried if she set her eyes on black items specifically before going to sleep. When this happened, she had the obsessional idea that it would trigger her to go blind or cause some other catastrophe. So, every time she experienced this, she felt compelled to imagine an item of a much different color, specifically white, as a way of preventing these ill effects. These examples should make it clear that compulsions aren't exclusively motor behavior, but can be psychological acts as well. Covert compulsions are also described as cognitive rituals or cognitive compulsions. The active nature of compulsions. A feature of compulsions that needs to be worried here is that an obsession is actively brought about by the patient. He is not happy about doing it, but it is essentially his voluntary action, performed because of his compulsive desire and not an automated behavior. Therefore, it is different from tics and muscle spasms that are typically found in some people, specifically children, which are basically uncontrolled motor responses. Those aren't actively produced by the patient, making them different from compulsions. Resistance fixations and compulsions are usually resisted. At one time, it was considered by many specialists that resistance was an important feature of obsessive compulsive disorder. Still, we now know that this is not the case. Although in the huge majority of cases, the person does resist the fascination or the compulsive urge, there are many exceptions, specifically with regard to compulsions. It appears that in the early stages of the disorder, a patient withstands his compulsive urges strenuously, but after repeated failures over a period of time, he might start to show much less resistance. Patients with chronic obsessive-compulsive problems could experience little or no resistance to the fixations or the urges.